Hi, everybody. My name is Kelsey Romero, and I will be doing a brief presentation on schizoaffective disorder. What is schizoaffective disorder? It is a chronic mental health condition characterized primarily by symptoms of schizophrenia, such as hallucinations or delusions, and symptoms of a mood disorder, such as mania or depression. It is less studied than schizophrenia and bipolar, and it has overlapping symptoms between the two. Therefore, it is often incorrectly diagnosed. It affects 0.3% of the population with an even ratio between men and women, but men are often diagnosed at an earlier age. Like I said before, some of the symptoms include hallucinations, delusions, disorganized thinking, manic behavior, and depressed mood. Some of the causes are due to genetics, brain chemistry and structuring, stress, and drug use. The diagnosis is often difficult because it has symptoms from both. But in order to be diagnosed with this specific disorder, you need to display mania or depression that occurs the same time as schizophrenia symptoms. You need to have delusions or hallucinations for 2 or more weeks in the absence of a major mood disorder episode. You need to meet the criteria for a major mood disorder and have them present for the majority of the illness. And abuse of drugs or medication are not responsible for the symptoms. Some classroom behaviors that students with schizoaffective disorder face are lack of concentration, disorganization, difficulty completing tasks, frequent tardies or absences, angry outbursts. These are just to name a few. So to elaborate on those, these challenges can cause behavior or performance that may fluctuate from day to day. Students are likely to exhibit thought problems or physical complaints, or they may act out or become withdrawn. They may show little or no emotional reaction. At other times, their emotional response may be inappropriate for the situation. They may also have possible frequent or extended absences from school for medical intervention and difficulties with relationships, such as with their peers. Some strategies for the teacher and or counselor would be to assist the student in making reasonable goals and giving student short, concise directions. This allows the student to not feel overwhelmed, to not feel frustrated, to not become stressed. Another good strategy is communication with the family. The teachers and parents need to form an alliance to meet the needs of the student. Therefore, you can obtain a wealth of information from the parents because they know the student best, and the parents can help you navigate through the school year. And it is also vital to have an open communication throughout the year so that the parents know what's happening at school and you know what's happening at home. Another good strategy is getting to know your student. Showing an interest in what they're doing helps the student feel safe. Being observant in your student. When doing this, you will discover how the child reacts to various situations, and you will be tuned in for their needs. Another important strategy is to have a contact person and a safe place. This contact person must be designated ahead of time to help this child during a period of distress. And the contact person should be educated in this disorder to help the student to the best of their ability. Having a student be able to leave the classroom and go to a safe place allows the student to maintain dignity by providing a private place where they can feel safe. Lastly, educating yourself is another vital tool because that way you'll be able to know what the disorder is, how you can help the student, what the disorder looks like, and just be able to be flexible if something happens. This will not only help you, but it'll also help the student, and it'll also help the classroom run smoothly. Lastly, being supportive and available. If the student knows you are there for them, if the student needs you at a certain time, and knowing that they have your support will help them in the long run. Lastly, these are my references that I used for my presentation, and that's it. I hoped you learned some new facts, And that's it. Thank you.